So one of the things that we discussed was that through ARHQ and HRSA and CMS, which stands for
Centers for Medicare and Medicaid Services.
CMMS, double M.
Only one M in the, don't ask me why.
A single M, a long M, S. That certainly CMS has a great interest in cost-effective, efficient, effective health care. One. Number two, they also have potential financial resources to fund pilot projects. That ARHQ and HRSA both have public and private venues where demonstration projects can happen because of these partnerships with things like Kaiser and big healthcare systems, or in HRSA's case, the very large network of primary care providers under HRSA's umbrella. So it resulted in this, and let's see if I can say this correctly, because we left before it was done. The Education and Quality of Life Subcommittee recommends that CMS/ARHQ/HRSA develop a private and public demonstration project to put into place diagnostic and treatment paradigms that would result in effective and efficient assessment and therapeutic care, resulting in improved health outcomes and better value of invested health care dollars. Now, my committee hasn't heard that said like that. Did the committee think that the wording was okay? The word value is in there. Better value of invested health care dollars. We have that. And we have effective and efficient in there. We could tweak the words maybe a little bit, although I've learned that tweaking is something meth heads do, and I should stop using the word. I use it all the time, and now I've been told, Mom, you're so out of it. Don't use the word tweak. It's got negative connotations. So we shall improve on the wording, but I think the wording's okay. The idea is to develop a demonstration project and to use reasonable clinical care as our current setting, but it would and then improve on that. Be able to set into place in these two systems the way to both put into play treatment paradigms and diagnostic paradigms, and then monitor outcome and see if they make a difference in spending and in health.
So we're recommending that the Undersecretary or the Secretary task those agencies to do that?
Yes.
Yeah.
Any seconds?
Second.
Any further discussion?
Can you help us, Nancy, just maybe understand what that might look like, what a kind of, maybe just some, maybe examples of how it might get implemented?
Well, let's take a healthcare system like, maybe Kaiser's too big, but one of those kinds of big healthcare systems. You could start with some templated care. So, for instance, you might have some survey instruments that capture a fatigue population. Then you would give to that survey population a set of instruments that would capture sleep, various aspects, sleep autonomic and so on. And then if the bar were such, it would result in a sleep study. A bar were such, it might result in a tilt table test. So diagnostics would then ensue. And then based on that, treatments that were appropriate for the sub parts of this. So right now, the average patient has to act as their own primary care and triage person, and they run around from specialist to specialist, and they get massive health care costs as they first go try to find anyone that will even believe them, and then listen and act, and then oftentimes they use the only sleep study they got in a place that only was looking at apnea, and so they don't get another one for 2 years because that's all their health care plan will pay for. So if you can put into a system where the appropriate study is ordered, the appropriate questions are asked of that study that would result in the appropriate type of therapeutic response, you could really streamline and make very clean the assessment and the treatment process. And then you could query people that went through a system that had these types of sort of templated care steps. Did those patients do better, and did they save money? And I think you could easily answer that question. And systems are very well suited to these kinds of survey-based.
Provide software to these potential companies that could potentially.
Well, we wouldn't do. What they would, the task force that would. I mean, the task would be to these agencies who would then engage experts to inform the process, and they would suggest the appropriate instruments that would move from step A to step B and step B to step C. And since the EMR is going in at the same exact time, if it's not already there, it's a very doable project. It's a project that 5 years ago we couldn't have done because the electronic medical record couldn't have helped us. Now the patients are used to surveys and the scores do go into the records and things are moving along in that way, and these bigger systems are much further along down that path.
Excuse me. Are you saying that this is ready to roll out, or do you think this is a research project at this
It's not a
point?
research project.
Well,
You don't want
why
to couch
not?
it in terms, well, research is obviously a part of it, but this is a healthcare utilization type of research project. It has other aspects as well.
I know people that do that kind of research, actually.
Of course, we've been really, really stymied as a committee to move forward down this path. And if we had such demonstration projects being promoted by this committee and the secretary through the agencies, I think we could just kickstart some of this stuff.
So, Art, can you enlighten us on what aspects are they studying or researching, and how can we apply it to what we have?
Well, I think that it's all researchable. That you develop a model, and you compare it to usual care, and you see how much it's reducing cost, improving outcomes, what aspects of the care are having the greatest effect. I think that's all. It sounds like what I do all the time.
So, correct me if I'm wrong, would the Medicare agency, CMS, contract such a project out to experts in the area, or would they keep it home and try to develop it within the agency?
Well, they might do it, ARC might do it. We would probably work with existing systems that might have some academic partner involved,
So in the end, yes, it could end up being a combined research project and a health care access.
So what's not clear to me is when you say the word pilot, whether that's actually kind of an attempt to actually do what you're suggesting, or are you kind of talking more about developing guidelines that basically would show how it could happen?
No, we're trying to make the whole thing actually happen.
So you
Developing
want
guidelines does just is guidelines. It doesn't get there. And they may not even be perfect guidelines, but then you have something you can test. And you say, well, that was okay. We could do better. But to start with something, so you could have something you could then
So let me
compare
kind of
improvements
throw
to.
to both of you, and this is, again, Nancy's question. Are there funds potentially available to do something where you actually have this pilot that's out there, where you're collecting data on it, or are you, in terms of what's the funding mechanisms for doing these things?
I can't speak to